Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today I am going to talk about a short case. Before going to that short case, let us see this video. This patient presented with the following complaints. One is black eyes, which is otherwise called as raccoon eyes or panda eyes. The second problem is redness in the white of the left eye. Both these things are present for the past 2 days. In the history of presenting illness, the patient told 2 days back the patient was apparently normal. Then he suffered a fall from his bike, following which he developed the problem. So there is a history of trauma 2 days back in this patient. When I asked the patient how long after the trauma the patient developed redness of the eyes, the patient told it occurred almost immediately. There are two situations in trauma. You can develop redness immediately following a trauma in case of local injuries to the eyes, or it may be little bit delayed in case of head injuries. In case of head injuries, because there will be bleeding coming from the skull or from below the skull, gradually it extends towards the eye. So it may take some time for the redness in the white of the eye to occur. In the history of presenting illness, we have to ask one question, whether this redness of the eyes is for the first time or it is a recurrent one. If it is a recurrent one, patient might be a hypertensive patient, patient may be a diabetes mellitus patient, or it may be a arteriosclerosis affecting the vessel walls, leading to breakdown of these vessels and causing hemorrhage. It may be due to a blood dyscrasias like leukemia, thrombocytopenia, purpura, or clotting factor deficiencies. It may be due to a vicarious menstruation. Patient will have cyclical redness of the eyes, just like the cycles of menstruation. If it is for the first time, all these causes given under recurrent hemorrhages can also occur for the first time in the eye, causing the redness. It may be due to infections, that is a conjunctivitis caused by tuberculosis, pneumococcus, picornavirus and adenovirus. It may be due to a retrobulbar hemorrhage extending anteriorly. Whenever you give a retrobulbar injection, it can cause damage to the vessels behind the eyeball, leading to retrobulbar hemorrhage, which can present as a redness of the eyes. Increased venous pressure in the head caused by chest or neck compression. A patient caught in the stampede, the chest pressure is increased, leading to hemorrhage in the eyes. Patient is strangulated. Patient had attempted hanging or patient had hanging. All those things can lead to subcutaneous hemorrhages. Severe and violent cough. A patient coughing violently and severely can lead to increased venous pressure, leading to hemorrhages and redness in the eyes. In the local examination, this patient had blackish discoloration around the eyeball, that is around the lids. Patient had a bright red homogeneous discoloration, which is red in color, present in the temporal and superior bulbar conjunctiva. You must have seen that video when I asked the patient to move the eyes. we are able to see the posterior limit of the bright red, homogeneous red color discoloration. That is very, very important in this case. On examining the other structures in the eyeball, all the other structures were normal and the visual acuity is also normal. This is what the patient had. Now, you must be asking a question, why this posterior limit is very, very important. If the posterior limit is visible, if the hemorrhage is well demarcated all around, then it is because of the hemorrhage from the eye itself. There is hemorrhage in the eye itself. If the posterior limit is not visible, if it is extending into the orbit, it may be due to hemorrhage from behind the orbit, or it may come from a hemorrhage from the skull because of the head injury. Whenever the posterior limit is not visible, we have to be alert in taking care of the patient, because patient might have had a skull injury which may be endangering to the patient. The diagnosis for our patient is both the eyes, ecchymosis of the eyelids, plus subconjunctival hemorrhage of the left eye caused by trauma. Coming to the differential diagnosis of a subconjunctival hemorrhage, it is redness of the eyes, red eyes. The red eyes may be due to a hemorrhage or it may be due to inflammation. In inflammation, you will have engorged tortuous vessels leading to redness of the eyes. In subconjunctival hemorrhage, you will have bleeding. There will be a sheet of blood that is spread below the conjunctiva, leading to a homogeneous red discoloration. Homogeneous means it will be uniformly red in color. You will not see this arborizing or branching pattern of redness. In conjunctivitis, you will have engorged vessels which are very red. You can see these vessels. In between the vessels, you can have normal white conjunctiva. Normal white conjunctiva. But it is not the same with subconjunctival hemorrhage. It is homogeneous redness, that is uniform redness. So this kind of redness can be seen in conjunctivitis, scleritis, episcleritis, uveitis, all those conditions. You can see this kind of redness. Whenever you make a diagnosis of subconjunctival hemorrhage in the examination, examiners will definitely ask you about various types of eye injuries, that is open globe injuries and closed globe injuries. In each one of these injuries, what are all the problems you can develop in each one of these structures of the eyeball. You have to get prepared for this and you should be ready to answer the questions asked by the examiners. Talking about the treatment for subconjunctival hemorrhages, you have to think about the following things. The first thing you should think about is the cold compress. Cold compress is beneficial whenever a patient is having a trauma and you are going to see the patient immediately. If you give a cold compress to the eyes, then it will stop the bleeding and the amount of hemorrhage will be reduced. Our patient is having the problem for 2 days. Already the bleeding has evolved into a bigger one and it has stopped also. Now if you give a cold compress, it is not going to be of any use. Our case will be benefited by warm compress. Warm compress is application of mild heat to the eyes. You can use a cloth immersed in a hot water. You must make sure it is not very hot. It should be just warm, and you can give a warm compress to the eyes, or you can blow a clean cloth with a clean mouth and you can apply that warmth over the eyes. That will help in resolving the hemorrhage at the earliest. The third most important thing is the treatment of the cause. We have enumerated so many causes. you should find out what is the cause for this hemorrhage. If you can find one and treat the cause with your drugs or other means, then the patient will not get hemorrhages in future. The fourth important thing that you have to follow in the treatment of a subconjunctival hemorrhage is giving assurance to the patient. What is the assurance? Already the hemorrhage has occurred. Whatever treatment you are going to give to the patient will not cure the problem immediately. It will take some time for the hemorrhage to resolve and the eye to become normal. Usually it takes around 3 weeks for this subconjunctival hemorrhage to resolve. So you should tell the patient, whatever may be the treatment you are going to give for you, this hemorrhage will resolve only over a period of few weeks, that is around 3 weeks. This way you explain the patient, definitely the patient will be happy and definitely these hemorrhages will resolve. With this, we will stop this video here. We will talk about some other short case in the next video. Thank you.